Hello everyone, this is Susma explaining in brief about robot used in robotic surgery from circulator nurse perspective. So this is robot and this is robotic tower. At the top is monitor. Below that there are two spots where different kind of gas tubing can be connected. We use Bovi or cartridge generator in open surgery. Likewise, this part of robot acts as a power generator for monopolar and bipolar electrosurgical unit. And this is where robotic cameras on sterile part is plugged in. Here on the side of robotic tower there are two CO2 tanks, and CO2 gases are most often used in robotic surgery. And this is robot with 4 arms, 1, 2, 3, 4. On the back of robot there is a display screen. As you turn on the display screen you can see commands that says deploy for draping, stow and enable joystick. And to the left there is a command called select anatomy. Click on that and choose one of the options according to the area of your surgery. Similarly, at the bottom, choose patient's right or patient left depending on which side of the patient robot is standing during the surgery. Likewise, if we click on deploy for draping, robot will adjust its boom and arm so that we can drape robot with sterile drapes. Similarly, to adjust height and position, there are two joysticks below screen. To enable those joysticks, we should click on enable joystick and move joystick at the same time. For example, click on enable joystick and move the joystick that says boom height upward to increase the height of boom or robot, or move the joystick downward to decrease the height. The joystick that says boom position is to move right, left or forward or backward. And the important part of circulating is to drive the robot. Push in the thing in handle along with moving robot. You can see there is a manual operator at the foot of robot. So in the middle of case or at the end when the robot is disconnected and you need to put the robot together, click on stow. Now robot will adjust its arm and boom accordingly. Similarly, how to move the robotic arm? So there are two buttons at the top and at the middle, as you can see in video. Push on those two buttons at the same time and you can move arm sidewise or flex or extend the arm of robot. So after the surgery is done, click on store to store the robot in its designated space or area. One more thing, there is a red button which is for a emergency stop. Also there is a thing called surgeon console. This is surgeon console from where surgeon operate robot for surgery. And this thing is like eye of a surgeon through what the surgeon can see anatomy on a screen below. And this is like arm that helps to manipulate the arms of robot. Even in the surgeon console there is a on and off button. You can see here, and there is a emergency stop button too, and at the side there is a button which helps to stop a food system that's under the feet of the feet of the surgeon. Here you can see. So this is it. Thank you.